TMJ stands for temporomandibular joint, which is the jaw joint. A disorder of the jaw joint is called TMJD. It affects people in different ways. Some people will experience pain in the face. Some people will experience it as a headache or a pain in the neck. And then there are all variety of different symptoms like ringing in the ears or a feeling that the teeth don't meet together properly. Because there is a very broad spectrum of symptoms that's included in TMJD, and because not every patient suffers with exactly the same symptom profile, it's been very difficult to actually define TMJD. What that means is that there are a lot of people who are undiagnosed and therefore untreated, and there's a whole cohort of patients who could potentially benefit from Cerezen intervention who are not even aware that they have TMJD. It's fair to say that nearly every dentist in the country each day of their practicing life will encounter a patient who suffers from TMJD. Within the academic literature there has been quite a range of prevalence reported, up to 30%, so at any given time 30% of the population might suffer from TMJD. In reality, the treatment that a patient has received for TMJD has depended largely on the healthcare professional that they have attended to seek help for their TMJD symptoms. So if a patient had attended a dentist, they would have received a mouth guard, and a mouth guard protects the teeth from damage that can arise if someone is bruxing, if someone is grinding their teeth, but it doesn't actually stop someone from grinding at night because that's a subconscious behaviour. The problem arises if a patient has used the mouth guard but has not responded favourably, so the symptoms have persisted for a period of time. A lot of dentists in that scenario then are a little bit unsure about how to manage their patients and often end up referring them to secondary care, to the hospital setting. At the point at which then the mouth guard is ineffective in relieving symptoms, a lot of dentists then are not sure how to manage the patient. So we all know that prevention is better than cure, and what Cerezen works to achieve is actually getting to the source of the problem and preventing a problem from progressing and arising in the first place. And this is a big advantage over some of the other treatments that have been used in the past. Because the Cerezen device is very discreet, a patient who suffers from TMJD can wear it both at night and during the day without it being intrusive into their social interactions in the workplace or at home. The Cerezen campaign is set out to educate people who suffer from the symptoms of TMJD and also to educate the dentists who could potentially provide Cerezen treatment for those sufferers as well. Every dentist can adopt the use of Cerezen within their clinical practice, and it provides them with an alternative treatment that they can give their patients who suffer from TMJD. Because such a large proportion of the population suffer from TMJD, it's very exciting that there are new innovations in this particular field of medicine. The advantage of Cerezen over and above all the other treatments to date is that it's completely non-invasive and there is no risk to the patient. So as a first-line treatment, if we were to design a protocol for a patient, trying Cerezen in the first instance is a really good step to take for almost any TMJD sufferer. It works for a lot of patients, and that's great. If it doesn't work, you can always move on to other treatments like we've discussed, the mouth guard, etc. But trying Cerezen as a first point of call makes sense to me.